line count of each individual case. The current case count in King County overall is 31 cases and 9 deaths. Today's new numbers are 10 cases and 1 death. As you all know, this is a fast-moving situation, and we're getting information in real time. The information we provided to you is all the information we have right now on these cases. And as you know, we'll keep you updated with more as we learn it. If you have additional technical questions about what we've provided you, one of our public information officers can talk with you afterwards. Speakers today include Dr. Jeff Duchin, Health Officer for Public Health Seattle-King County, King County Executive Dow Constantine, Patti Hayes, Director for Public Health Seattle and King County, Dr. Kathy Lofi, the Washington State Health Officer, and Dr. Tom Clark, Deputy Director of CDC's Division of Viral Diseases, is also available for questions. With that, I turn it over to Dr. Duchin.
Thank you, James. Good afternoon, everyone. I'm Jeff Duchin, Health Officer for Public Health in Seattle and King County. And as you know, we are here today because of this unprecedented outbreak that's facing our community. And in particular, I want to give you an update on the situation at the Life Care Center in Kirkland. This is a very stressful situation for the families of the residents of the center, for the loved ones. And I want to emphasize how distressing we understand this is, and again, extend our heartfelt sympathy and condolences to the family members of those who have died and who are ill. This morning, we deployed 2 of our physicians that had been previously working on our outbreak containment efforts to assist the staff at the Life Care Center with assessment of their staffing needs and the clinical status of their patients in order to ensure that they're getting the highest level of care that they require, and that any patients that require to be hospitalized are identified promptly for hospitalization through transport. That assessment is ongoing at this time. Our primary concern and our priority remains the health and safety of the residents of Life Care, the caregivers and healthcare providers in that setting, the healthcare providers in our community, and our community at large. We are interested in trying to decrease the risk that this infection poses to all of us. We have a CDC team that's been on site and continues to be on site at Life Care, providing infection control guidance to their team. They're working with the leadership of the facility as well to facilitate infection control strategies to protect the residents and the caregivers. We understand, again, how stressful this is. This is a very uncertain time. There's a lot that we don't know. There's a lot that we don't understand about this new virus, about how it's moving, the spectrum of illness that it causes, and how it's transmitted. But we are doing our very best to ensure that we provide the highest level of guidance to protect the health and safety of our community and of our healthcare workers that are caring for our community members. I also have received a number of emails from family members at Life Care, and I want to apologize to all of them because I haven't had time to return those emails personally, although I would have very much have liked to. I understand that they are very concerned, and rightly so, about the health of their loved ones in the facility, and I want them to know that I am as well, and that we are doing everything possible to make sure the facility gets any staff, any training, and any assistance that they require to make sure that their loved ones that are in that facility get the best possible care. We are planning to develop a team to make sure everyone in that facility can be tested for COVID-19, but I want the families to understand that the care that they receive is not dependent on the results of their test. Remember that there is no specific treatment for this disease. There's no preventive measure. So whether or not they test positive or negative, they will still go to a healthcare facility if they require to go to a healthcare facility because of their medical condition. It's good for us to know, but at this point, we assume that if someone is in that facility, they likely have been infected or at high risk for infection, and they're being managed as if they are. We'll continue to provide updates as we get new information. And, I just want to remind again that COVID-19 can cause severe disease, as we see in the context of the life care outbreak, but that for many of us, the disease is mild and moderate. The vast majority of people do not require hospitalization or medical care for that matter. And we do encourage people who have mild illnesses, please don't overload our area healthcare facilities. Please don't go to the emergency department. If you're worried about your health, please call your healthcare provider before you go in. They're now going to turn the podium over to County Executive Dow Constantine to talk about some measures that we are recommending to help individuals in the community decrease their risk of COVID-19 as this outbreak continues to progress.
Thank you, Dr. Duchin, and thanks to everyone for being here today. I want to join in expressing my deep concern for the residents of Life Center and what they're experiencing today, and to acknowledge the families who've lost loved ones, the families who are concerned for their loved ones who are there at the facility, and to those who are recovering. Our community stands with you in these difficult times. This is a shifting landscape, really shifting by the hour. And as this outbreak progresses, public health leaders and policymakers must adapt and establish new sets of expectations and recommendations. We have multiple objectives. We are determined to slow the spread of this virus in the community. We are determined to protect those who are most vulnerable, our older residents, those with compromised immune systems, and others. And in doing those things, we also want to protect our economy, to make sure that we're able to continue to have people be employed, to have people be able to work. The reality is this: the more we slow down the spread of this virus, the more we slow down the disease, the greater the chances of keeping people healthy, of saving lives. As such, we are recommending, though to be clear, we are neither requiring nor mandating additional steps to minimize this outbreak. For older people, which my staff and public health has defined as people over 60 with underlying health conditions, I think that that is going to be something that is considered on a case-by-case basis. And for those who are pregnant, we are recommending that we stay home and avoid large gatherings as much as possible. We are encouraging employers to maximize telecommuting and to make it possible for employees who can work from home to do so. Community groups should avoid creating large gatherings, and the rule of thumb that public health has recommended is gatherings of more than 10 people. Again, you're going to hear this often from us. Those who are sick must stay home. Please stay home. And if you are ill, please call your doctor's office. Don't go in and expose others. Don't go in and overwhelm the medical system. Public Health Director Patti Hayes will soon explain public health is not making a recommendation to close schools. It's a question that comes up often. As an employer and a regional government, King County is following these recommendations ourselves. We are putting them into practice. All non-essential King County convened large group meetings will be canceled for the next 3 weeks or through the end of March, and we're going to reassess that decision as we move forward. Employees who can telecommute are going to be encouraged to do so. We are going to plan to do this for the coming 3 weeks, but I'm going to have us reassess at the end of each week to determine whether our measures need to be adjusted. We want to make sure that we're doing the right thing, both to protect employees from becoming ill and to ensure that services are continuing to flow to the public. We have a diverse workforce, and many of our dedicated public servants must report for work in person. Telecommuting is not an option. They serve our public directly. Let me give the example of bus drivers. This, of course, raises equity issues within our workforce. That is a reality that we and other employers are going to have to wrestle with. But we are committed to making sure that those employees who are reporting in person for work can stay safe, can stay healthy, and can stay on the job serving the public. As you know, we are continuing to site facilities for the isolation and treatment of those who've been exposed to the virus. We've placed modular units near White Center, and we chose that location because we own the land. The site has access to utilities, and with our emergency waiver that I've signed, we can expedite construction. I understand the community has questions, as will all communities, and we are answering those questions. But I want to be clear, we must move quickly to stay ahead of this outbreak. Every location that we select will be set up and staffed and monitored appropriately, and we are seeking additional locations wherever available throughout all of King County. At this time, I can announce that we have secured 2 additional locations for modular units, one at Interbay and one in North Seattle. We have finalized the purchase of the motel I mentioned a couple of days ago, and that is located in Kent. We're working with the community and hope to have it operational within days. Now, for those of you who are interested, our communications folks have the address of that facility, and they're going to be offering a tour of it this afternoon. These are stressful times. This virus will test our resiliency, and it will test our compassion and our ability to look out for one another. We are answering thousands of questions from media, questions from community members, from businesses, from other governments. At the same time, this situation requires us to act with urgency. We all need to be in this together. People from across our region have reached out asking what they can do to help. It's been tremendously gratifying. And we are coping with the most serious outbreak of COVID-19 anywhere in the nation. Our actions are forming the model that will be followed in other parts of the country. We will get through this. Our entire government, particularly the scientists and public health leaders who are working round the clock day after day, are committed to returning our community to normal as quickly as possible. I'd like to introduce to you the Director of Public Health Seattle and King County, Patti Hayes.
Thank you, Dow. I want to start by echoing what Dr. Duchin and Executive Constantine have said about how we're approaching this novel virus and its risk to the public, our deep concern for the situation at Life Care and the community as a whole as we face this unprecedented challenge. Your cooperation and your patience are vital to the community's success and ability to stop the spread of COVID-19. So today, Public Health Seattle-King County is taking proactive steps to protect the health of our community by making these recommendations. As you've heard, they're meant to slow the spread of novel coronavirus in our community and reduce the number of people infected. You know, first on my mind is always our entire community as public health. I think about all communities' needs. And then knowing what's happening with this virus, my mind and concern goes specifically to the stress on the healthcare system and the providers that are working in the field right now, our first responders. It's under incredible stress right now as we work to plan, coordinate, and assist those who are in need right now. As you've heard, the distancing measures that we're recommending are essential because We need to slow the spread of disease to the point where our healthcare system can continue to be able to handle the load. We do not want the situation that has been seen in other areas, in other countries, where the healthcare system was overloaded and unable to cope. So the measures that I'm talking to you about today work to achieve that. And as Executive Constantine said, we will be assessing this every day, actually, in my job, and we'll be meeting with the executive on a regular basis. A second reason we're doing this relates to the potential, even if it's a small potential, to prevent the outbreak from spreading and growing. You know, it's a new virus, and I've been telling people to talk to their neighbors who have questions about that, because I get the question, what's different from this than the flu? And I go back to what we've talked to you about before. There are three things. Number one, it's a new virus. There's no immunity to that. So we must be looking at those things that we can do with that in mind, that people are faced without immunity. Now, we know that 80% of people will not have serious issues, can be handled and maybe sick at home, but will be okay. It's that 20% that can get severe illness, where we want to do these measures so that we're protecting everybody. Secondly, there's no treatment for this virus right now. As you heard Dr. Duchin say, regardless of what the test shows, the treatment right now is what we would normally do for somebody who is having these flu-like, pneumonia-like, and severe lung infections. I know there are people who are working very hard on treatment, and I applaud them. That's happening locally, nationally, and around the world. Thirdly, there's no immunization, no vaccine for this. That's, again, being scientifically driven as quickly as possible. But for right now, my job is to recommend the best we can do to protect our community now. So specifically, we understand that the actions have a tremendous impact. And so we're starting with those things that we're recommending, not mandating. I want to reemphasize that. So first, for vulnerable people, let me repeat that people who are at higher risk of severe illness should try and stay home and away from large groups as much as possible, including public places where lots of people gather. For workplaces, as the executive mentioned, we're recommending that workplaces take steps that enable people who can work from home to do so. Taking these measures can help reduce the number of workers who come into contact with COVID-19 and help minimize absenteeism due to illness. Employers should maximize telecommuting for as many employees as possible. Employers should urge employees to stay home when they're sick. I can't emphasize that enough. Sometimes we are our own worst when we're sick and we come to work, aren't we? We need to support each other for when we're sick, we stay home. I've also encouraged employers to start staggering start and end times. That reduces the large number of people coming in and out at the same time on our mass transit. I've even noticed a difference on I-5 since we started messaging it. I don't know if any of you have, but regarding events and community gatherings, if you can feasibly avoid large groups of people together, consider postponing those meetings. We're talking to community-based organizations, we're talking to employers, and we're talking to our groups who are coming and want to come to Seattle. We are asking all of our residents to take these steps and slow the spread. Now, let me talk specifically about schools. We're in dynamic conversations with schools on a daily basis. Public health is not recommending closing schools at this time unless there has been a confirmed case within that school. The reason we are not recommending school closures is because children have not been shown to be a high-risk group, which can be so much different than what we expect for other illnesses. Children who have compromised immune systems are, of course, in that other category that we need to be very careful with. Now, we respect every school's individual decision about closure or postponement of activities, as each school knows the needs of their community and is talking to their parents and their community lifetime. As I said, if there's a confirmed case in the school, public health will work with that particular school and the district to determine what measures are best to protect. And this could include the closure, and we will determine with that school the number of days and when reopening would occur. You know, schools are doing the important work of educating our children. We don't want to disrupt that unless we know coronavirus exposure risks are there. In addition to schools closures that can be disruptive and costly for families, we know that as we're looking at this, we're assessing the potential benefits and the negative consequences of closures. We're learning from other experiences elsewhere because we know when schools are closed, children go other places, and we need to be mindful of that. Overall hygiene that we've talked to you about in our last number of releases and press conferences remains a key strategy. As you heard Executive Constantine and Dr. Duchin say, please, if you're not feeling well, if you're home and you're ill, call your healthcare provider before you show up. We are talking to those healthcare providers about helping people on the phone and be screened so we don't crowd the rooms at the clinics. You know, some are already working on all this. As I said, we're seeing fewer cars. And as reported in the news, events at Amazon and Microsoft have been turned into online meetings. We've noted that some religious services have either been postponed or they're being done in a different way. I see that people are shaking hands less, doing the elbow bump. The things we're asking people to do are definitely different, but they're doable. You know, we as public health officials weigh the potential benefits for the community along with the significant impacts. And these recommendations on our community and the impacts are weighed with our elected officials. In consultation with CDC, we developed these recommendations based on the rising number of cases we have in our community and the importance of taking these actions now to further reduce transmission. I want to reemphasize again the importance for all of us to do our part during this outbreak. And now I'd like to introduce Dr. Kathy Lothe, our State Health Officer.
Well, good afternoon, everyone. I'm going to just quickly give you a brief update on the statewide COVID-19 situation, and then I'm going to also give you a brief update on testing capacity here in our state. So as of midnight last night, there had been a total of 39 individuals diagnosed with COVID-19 in our state. This includes 31 King County residents and 8 Snohomish County residents. That total number of 39 individuals also includes 10 deaths. 9 of the individuals who have died are King County residents, and 1 is a Snohomish County resident. Now I'm going to turn to give you a brief update about testing capacity. So we know that, first of all, we know that there is a huge demand out there for testing. There are lots of people in our state who are sick, and they want to know whether they have COVID-19 and they want to get tested. And I want to tell you that we are doing everything possible to quickly expand testing capacity here in our state. So there are a few things that have happened over the last 24 hours. First of all, many of you may have heard that the federal government relaxed the criteria for who can be tested with the CDC COVID-19 assay. And this was great news. And basically now anyone who has symptoms that may be consistent with COVID-19 infection can be tested. We are working really hard in Washington to increase the testing capacity. As I have told you before, the Public Health Laboratory in Shoreline has the capacity now to test about 100 people per day or 200 specimens. Each individual generally submits 2 specimens. And we are ramping up this capacity. We have purchased new equipment. We have 2 new pieces of equipment that should be delivered today or tomorrow, and we've quadrupled our laboratory staff that are doing testing. In addition, it's been a very high priority for us to work with our commercial lab partners to bring additional testing capacity, additional testing capacity to Washington. We continue to work with the University of Washington Virology Lab and expect them to be ramping up their tests in the upcoming days. In addition, our state public health laboratory director called almost all of the large commercial labs in our state yesterday and encouraged them all to start using a COVID-19 testing assay so we can have additional testing capacity. And there's a lot of work that's also happening on the national level with a lot of our very large national laboratories to encourage them to also begin testing for COVID-19. So currently, we still do have a temporary capacity issue with testing for COVID-19 here in our state, but we do not expect this to last long. I really feel like throughout the next few days, we are going to see considerable increases in the number of patients that we can test here. And I just want to reiterate what some of the previous speakers said. For individuals who have mild illness, you don't need to be tested. So this is important to remember. We're posting some new guidance on our Department of Health website, which is 2 pages of information around what individuals should do if they have symptoms consistent with COVID-19. And these are a lot of the same messages that we have been repeating over and over in the news conferences. They need to stay home from work. They need to keep a distance from other people in the household so they don't infect other people in their households. And they need to rest and take care of themselves. So with that, I will turn it back to James. Oh.
James.
So now I'd like to open up for questions.
Dr. Duchin, why did you not deploy physicians to life care before today, and is it time for the county or the state to take over operations there entirely? We've heard many, many complaints from families you've also been hearing about.
Yeah, the physicians that we employed or deployed today are physicians that were epidemiologists and physicians working with us on the outbreak response. They're not clinical care providers routinely, although they are expert trained internal medicine and infectious disease specialists. That's not their primary focus. And the facility itself has a staff, and when they had the outbreak, they had impacts on that staffing because many of them were exposed to the disease, became symptomatic, and are now sitting out, waiting the quarantine period. But we were in very close communication with them regarding their staffing levels, and we've been told that they are able to function, although we've anticipated that over time that may become increasingly more difficult. And so we've requested a DMAT team or disaster medical assistance team from the federal government, which is arriving tomorrow. So we've arranged for them to get assistance. And today we thought, because we heard they were having some challenges, that we should send some people out to see what's going on before that team arrive tomorrow.
How many times do you anticipate being able to test residents at Life Care?
Yeah, it's a good question. That's been a big challenge for us. We have been working with different healthcare providers to make sure that those patients who get into a hospital get tested promptly, obviously. And again, it's not necessary to be tested it doesn't impact the care that you're getting at the facility. Test positive, test negative, you get the same level of care. The test tells us that someone's infected, but there's nothing that's done in response to that test, specifically treatment-wise or care-wise. But we just heard from a community partner that they do have the ability to do testing in the field, and so we're trying to arrange that as soon as possible.
The longer anyone stays there, though, the higher their risk is. You acknowledged it yourself. Anybody who's in there very likely has been exposed. So why keep people there if there's a chance they don't have it at this point?
Well, the people who need to receive a higher level of medical care are transferred to healthcare facilities. The people who can be cared for in that facility, and they are using infection control measures to try and keep those who have symptoms that might be COVID-19 separated from those who don't. So that's why we have our CDC team on the ground to try and enhance those infection control precautions. They're stable and they don't need to go to hospitals, and we really need our hospital beds for seriously ill people. So it would be problematic to take people out of a facility where they're stable and put them into a healthcare system that is already stressed with our flu season and other critically ill patients. Because don't forget, the vast majority of people in our county do not have COVID-19, but they have a lot of other serious health problems that every day, are keeping our hospitals running very near capacity. So it's not a wise move to take people who don't need to be in healthcare facilities and put them in those facilities, because that means someone else who has an acute need for that facility wouldn't have access to those resources.
Dr. Lopez, testing. You have a couple follow-up questions regarding testing, if you don't mind. Thank you. I know that you talked about the demand for testing, and I know how vital the testing is in terms of getting our arms around this disease. But can you explain why there have only been 99 specimens taken out of that lab for 56 people since March 1st? The demand so high.
99 specimens taken, you mean tested at our laboratory?
99 specimens tested since March 1st for 56 people.
So our lab has tested a total of 209 samples for 91 people since we started testing last Friday. And we have, up to today, actually have been able to test everything that's come into the lab. We are starting to, bump up against our capacity issue, and that's why we've purchased more equipment and are bringing more staff in to increase the number of tests that we can do.
Your folks said yesterday that as of March 1st, 99 specimens and 56 people. Is that correct?
Is that CDC numbers?
No, that's from the Department.
Oh, okay. Well, we have not been testing since March. We've only been testing in our public health laboratory since Friday. So maybe we can talk after and clarify.
We can certainly do that. Can you also talk to me about the protocol for testing has changed dramatically? And even before Vice President Pence talked about everybody who thinks they've got this disease or this virus wants to be tested, it changed last weekend or over the weekend with regard to people who have underlying conditions to be tested. Had we changed this testing protocol prior to now, is it likely we would have got more cases and perhaps even saved lives?
Yeah, so up to yesterday, the testing criteria have revolved around the criteria that the Centers for Disease Control and Prevention was using to define people who they thought were at risk, and they were calling those individuals persons under investigation. So those criteria for who should be considered under investigation have changed a few times since this situation has started. But they were still fairly limited. They were limited to people who had traveled to affected countries, who were sick and had been hospitalized, or close contacts of individuals of COVID, of patients with COVID-19, in addition to people who were hospitalized and had other infectious disease testing that was negative. So that it was still fairly limited, and the issue was there were a lot of individuals, with milder illness who really wanted to be tested. And yesterday is when our federal government announced that now that test can be used to test even people with mild illness who don't meet those criteria that the Centers for Disease Control had outlined.
Is it your opinion we waited too long to change the criteria?
The criteria, we kind of needed to stick with that criteria, but now that we're really expanding capacity, it's great that now, the feds our federal partners have now said that test could be used for people with mild illness.
Dr. Duchin, can you speak to reports that there was a potential case at the jail today, and also about what the planning is if there is an outbreak within the jail?
I'm not aware of a case or of a report of a potential case in the jail.
I can speak to that. So, middle of the night last night, SCORE, the facility, the jail facility that's owned by several of the cities down in southwest King County, transferred an inmate to King County Jail, brought them to booking. The people working in the jail at the time looked at him, thought that they appeared ill, they were coughing, and sent them to Harborview. So they were not actually admitted to the jail. At that point, those employees shut down booking for a while so they could make sure that they worked up through the chain of command and they were doing the right thing, and then the booking reopened. So they did not. Pardon?
What happens if there is an outbreak?
I mean, we are being very vigilant about any either staff or inmate who would have symptoms, and they would be isolated immediately. I don't know of anyone who is currently being isolated from the jail, but obviously that is a significant concern. I mentioned employees who can't telecommute, who can't work remotely, in addition to bus drivers, clearly jail guards, people who work at the sewage plants. There are a lot of employees in King County who serve our public directly and have to be there in person, and we are working with their managers and directors and public health to make sure we're taking every possible measure to help keep them safe.
Dr. Duchin, CMS Chief Seema Verma has said that she is sending inspectors to Life Care facility to try to find out if they're following inspections, if they were following guidelines. How do you break up the role of CMS, and you have people in there, who's doing what in the facility?
Our role, local public health, working with our local healthcare system and our colleagues from the Centers for Disease Control and Prevention, is to support that facility, the patients and the healthcare providers. Our top priority is to keep their patients safe and keep their healthcare providers safe. We are not a regulatory agency. So although we have collaborated with our colleagues at Department of Health who are also assisting with this response, we understand that the last time they were in looking at infection control practices, the facility did well. But we don't do inspections and grade or otherwise regulate those facilities.
Dr. Duchin, can you talk about families of those at Life Care who have been exposed, potentially infected now? What's the direct plan of action for them? Self-quarantine? Yeah. Do you go to your healthcare provider? Do you stay at home?
Thank you for that question, because I know communication with the families has been challenging for us, and this is a very good opportunity for us to get a message out. If families have spent time in the facility, we would like them to be aware of a couple of things. One is they may have been exposed to COVID-19. So for people who may have been exposed to COVID-19 and they have symptoms, cough, fever, we would like them to isolate at home, stay away from others, and contact their healthcare provider for an assessment. And if the healthcare provider is concerned, we can facilitate testing. If someone has been in and out of the facility and they're well, they're not feeling sick, they don't need to restrict their activities, but they should watch their health, and we recommend for 2 weeks, and see if they develop anything in that time. And if they do, take the same steps that I recommended for someone who has symptoms now, which would be separate yourself from others, contact your healthcare provider, let's talk about your symptoms, see if they're worrisome, and whether or not you would need to be tested.
So to be clear, only those that are high risk, 60 or older, with pregnant and things of that nature, those are the only people who are being recommended to social distance at this point?
No. So thank you for that question. It's a very important message. We are focusing on two things as a public health department and as a community. We're focusing on containment. We want to still working as hard as we possibly can to identify every case, get them tested, isolated if the test is positive, to prevent transmission from that case to others in the community. That really is the single most important thing. In addition to that, we know that this disease is not able to be put back in the box. It's with us. It's with the world. It's going to be out there. Most people will do fine. Some people are going to be sick. And we want to minimize the number of people who get sick, and we want to minimize the number of people who get very sick. The way to do that is by decreasing the intensity and frequency of your contact with other people. So there are lots of different ways that can happen. Now, some of what you've heard some of the guidance that we've issued today, workplace, home, individuals, community gatherings, so on. The main message is if you don't have to be in close contact with others, which we define as about 6 feet, please don't at this time, because that will not only help you stay healthy, but will help our community stay healthy. So the point about the folks over 60, which includes my age group, the people who have underlying high-risk conditions, which are similar to those that we talk about when we talk about influenza, chronic cardiac disease, chronic lung disease, diabetes, weakened immune system. Pregnancy, we think, just as a precaution, we don't have good data that pregnant people are at higher risk, but we feel at this stage where so much is unknown, we'd like them to take special precautions as well. We want those people to know that they're at increased risk. So they might want to take this especially seriously now and do whatever they can do to decrease their risk of being infected. At the same time, we recognize that people need to go about their lives. There are things that people need to do. We need to keep our society functioning. We need to keep our businesses functioning, our schools functioning. There are things people need to do. We're not saying shut down the society, but we're saying take some simple steps to decrease your risk. So wash hands frequently. Don't touch your hands and face. Stay away from others who are ill. Don't go to work or school. This one is critical. If you're ill, even a little bit at this point, please don't go to work or school and expose your coworkers. Stay home until you're better for 3 days. If you have a fever, your fever's gone, you're feeling better for 3 days, then go back. The point about the 65 and older, the point about the people who are 60 and older and the other conditions is just be aware that you may be especially vulnerable and take these recommendations really seriously.
So why not shut down schools, though? I mean, kids can transmit the disease as well, can't
So I just want to, before we continue further, we have several folks, including our director, Patti Hayes, who need to go to critical meetings related to coronavirus at 2 o'clock. We'll take an additional 3 questions. So starting with you.
I heard you. Yes, so the question is why not shut down schools? So school closures have been part of the pandemic response toolkit for pandemic influenza for a long time. There's some historical information that looks at the impact of school closures on old influenza pandemics. There's some modeling studies that look at the impact of school closures, and there's some experience from 2009 H1N1 where schools closed. And I would say that we don't have strong evidence one way or the other about how important school closures are, about the timing of school closures or the duration of school closures. Nonetheless, in an area where there's a lot of uncertainty, they've remained in the toolkit. If you're going to consider school closures, again, we know we can't close schools forever, so we have to think what's the right timing, what's the right duration, and really, do we really want to close schools or do we want to keep schools open so faculty can continue to come in and maybe serve children who have special needs, get school food there, operate in some modified fashion? But the bottom line is school closures also have some very significant downsides. We know more about the downsides than we do at the benefits at this point. We closed schools during H1N1 and we saw tremendous community disruption. Parents had to stay home from work who needed to be at work. It affected our healthcare workforce as well. Many nurses were pulled out to care for their children. We found that the children gathered elsewhere when we weren't allowing them to go to school. They went to the mall. So there are questions about the effectiveness in the practical sense. There are also serious considerations around the negative impacts of school closures on parents and the communities in general. And we may have a paradoxical effect in that if your children are home from school, frequently it may be parents and elders that will be caring for the children, and those people are more vulnerable. In addition, with COVID-19 in particular, we really don't know the role of children yet in transmitting this disease. We don't know how important they are in moving this virus through the community. They can be infected, we know that, and we know that they tend to spread infections pretty well in general among themselves, but they clearly don't have a high serious illness rate. So it's not if this disease was very harmful to children, we would be closing schools, at a much lower threshold. So that's one consideration. It's not a serious disease for children. Very small percentage of children get serious disease. And then the other big unknown is how important are they in the transmission? And so with those uncertainties and with the fact that it's not causing serious disease, it's not one of the things we're going to go to right away. We're going to reconsider how this outbreak looks in our community. We're going to reassess every day, really, and adjust our strategies as necessary in close consultation. And I really want to express my sincere and heartfelt appreciation for our CDC team in here back in Atlanta that are working very closely with us, helping us fine-tune our response to this unprecedented crisis.
Could you talk briefly about the people in their 20s, the two of them who are hospitalized? That seems kind of an outlier and maybe cause for concern. 30s?
Yeah, so we do have two younger adults, but we don't have all the details on their situations, their exposures, how they might have gotten illness, or whether they have underlying medical conditions that would predispose them to severe illness. But it is definitely concerning. I mean, we do know that in other countries there's been a spectrum of illness. Younger people, much less likely to get sick. Older people, much more likely to get sick. People with chronic medical conditions, much more likely to get sick. But people at any age can be affected. It's just how many. So we are very concerned about these cases. We'll be looking closely at the situation, but I don't think that you can generalize from those cases or from the situation at Life Care to the risk for the general public. The general public still needs to remember that 80% of people do very well, that most people do not have serious illness. And what we're testing for is defining what we're seeing. We are only testing people who are seriously ill now, and therefore we're only recognizing people who are seriously ill as COVID-19 cases. If we were able to test everyone in the community, the number of non-severe, mild infections would vastly outnumber the severe ones.
At this point, we
have a direct hotline for these families. They say that they haven't been able to get answers. They've been on phones for hours with the CDC without any answers about what's happening at Life Care. Why isn't there a direct contact for them to get answers?
So thank you for that question. This will be the final question. We do need to go on to other matters. We will continue to keep you updated. We will provide case counts daily, and we'll let you know when our next briefing is. We will continue to keep you informed.
I'll try and address your question about the hotline. I would love to do that. Our call center has been completely overwhelmed, and we've been working with various agencies to try and triage the calls out. I will go back and see again if we can do anything particular for these families. I would love to do that. I really want to communicate with them. They need messages. I agree 100% with you. I apologize for not being able to communicate more promptly with them directly. We had hoped to get information through Life Care to them, but they had some technical issues contacting the families. So thank you. We will go back and reassess whether we can do something special just for those families.
All right. Thank you all.
Dr. Levy.
We're handing out the location of the hotel, the fact sheet. We'll be down there at 3 p.m. if you want to do photos. Sherry's got the location info right here. Coming down.